Practical clinical chemistry, total question 50, type multiple choice, single best answer, time limited suggested 60 to 65 minutes, passing score 70%. Fundamentals: what is the main goal of clinical chemistry? Genetic profiling, diagnosing disease via body fluid analysis, radiological imaging, surgical planning. The answer is diagnosing disease via blood fluid analysis. Which specimen contain clotting factor? Serum, plasma, urine, CSF. The answer is plasma. Icterus is a serum sample indicates elevated triglyceride, bilirubin, potassium, calcium. Bilirubin. Reference interval are determined the patient mood, a single measurement, testing healthy population, doctor opinion. The answer is testing healthy population. Which of the following can cause preanalytical error? Outdated reagent, incorrect sample labeling, power failure, typing error in result. The answer is incorrect sample labeling. Hemolyzed blood sample may falsely elevate sodium, potassium, glucose, creatinine, potassium. Measurement principle. Beer-Lambert law is the basis for potentiometry, spectrometry, electrophoresis, pH measurement. The answer is spectrophotometry. What does potentiometry means? Antibody level, ion concentration via voltage, light absorbance, enzyme activity. Ion concentration via voltage. An ion selective electrode is best used to measure cholesterol, creatinine, sodium. A rate reaction is different from an endpoint because it measures before the reaction starts, measure surgical changes over time, measure signal changes over time, is less accurate, measure at equilibrium only, measure signal change over time. A bank sample is used to set the instrument rate, clean, correct for background absorbance, dilute, analyte, correct for background absorbance. Which method measure the electrical potential of ion? Immunoassay, potentiometry, chromatography, gravimetry. Potentiometry. Complex sample interference. What is the purpose of pre-treatment in sample analysis? Increase sample size, remove interfering substances, eliminate calibrator, skip centrifugation. Remove interfering substance. Lipemia affect which type of measurement most? Potentiometric, colorimetric, gravimetric, pH meter. Calorimetric. An enzyme reaction usually measure weight, color intensity, rate of substrate change, size of enzyme. Rate of substrate changes. A turbid serum sample might interfere with glucose oxidase, ion selective electrode, spectrophotometric reading, chromatography retention time, spectrophotometric reading. Immunoassays are best suited for detecting potassium, pH, hormones and antibodies, cholesterol, hormones and antibodies. Accuracy and quality control. Accuracy is defined as reproducibility of result, closeness to true value, random error control, repeat speed. Closeness to true value. A certified reference material ensure label speed, traceable accuracy, date security, doctor approval, traceable accuracy. Proficiency testing evaluate new instrument, external lab accuracy, staff uniform, lab decor. External lab accuracy. A post-analytical error might include wrong result entry, poor pipetting, hemolysis, reagent containment. wrong result entry. Precision means the same result each time. Always correct, fast result generating, cheap reagent. The same result each time. Analyte and the methods. The Java method is used to measure glucose, creatinine, calcium, albumin, creatinine. Burette method is for lipids, protein, enzyme, glucose, protein. BCG dye bind to DHL, albumin, creatinine, potassium, albumin. High LDH is associated with increased risk of kidney failure, cardiovascular disease, anemia, diabetes insipidus, cardiovascular disease. PSA is a marker for prostate cancer, breast cancer, colon cancer, liver cancer, prostate cancer. Ferritin is best for assessing calcium status, inflammation, iron stores, liver enzyme, iron stores. C. Reactive protein is a marker for liver function, inflammation, electrolyte imbalance, enzyme deficiency, inflammation. ALT, AST are indicator of cardiac function, kidney function, liver injury, thyroid status, liver function. Which lipid is protective? LDH, LDL, VLD, HDL, total cholesterol, HDL. Therapeutic drug monitoring is needed for antibiotic only, toxic metals, narrow range drug, urine dyspeptics, narrow range drug. Clinical cases: a glucose of 280 mg per deciliter plus HbA1c of 9% suggests hypoglycemia, type 2 diabetes, normal glucose, insulin overload. Type 2 diabetes. A man with chest pain has troponin 1 of 3.2 nanogram per ml, likely condition pneumonia, angina, myocardial infarction, stroke. Myocardial infarction. A blood urea nitrogen of 60 and a creatinine of 3.2 suggests hepatic failure, chronic kidney disease, hyperthyroidism, low sodium, chronic kidney disease. Low hemoglobin, low ferritin, high TBC, sickle cell, iron deficiency anemia, hemolytic anemia, thalassemia, iron deficiency anemia. eGFR is a better kidney marker than creatinine because it's faster, it includes age and sex, it's color coded, it measure liver enzyme. It includes age and sex. Which analyte indicate kidney protein loss? Bilirubin, albumin, creatinine kinase, glucose. Albumin. Hyperkalemia is dangerous because it can cause headache, hair loss, cardiac arrhythmia, weight loss, cardiac arrhythmia. In dehydration, you would expect low blood urea nitrogen, high creatinine, high blood urea nitrogen, normal creatinine, low sodium. High blood urea nitrogen, normal creatinine. High LDL and low HDL increase risk of anemia, cardiovascular disease, liver failure, thyroid problem, cardiovascular disease. Which analyte would you monitor after a heart attack? Uric acid, CKMB, ferritin, albumin, CKMB. Lab kits practice question. Glucose test kits use JF method, glucose oxidase, pyrite, CRB, glucose oxidase. Which dye is used in albumin kits? Orange GG, BCG, picric acid, ferric chloride, BCG. Creatinine test kit typically used glucose oxidase, JF reaction, turbidometry, urease, JF reaction. HDL cholesterol is measured after total lipid dehydrolysis, LDL removal, BCG addition, creatinine suppression, LDL removal. CRP is commonly measured by ion selective electrode, immunoturbidometry, electrolysis, flame photometry, immunoturbidometry. A lab kit stored at 40 C may yield faster reaction, enzyme degradation, higher precision, no effect. enzyme degradation. What ensure lab test traceability to international tender? You may Google search certified reference material, free sample, water pass. Certified reference material. Which is most important when interpreting any test result? Patient age, clinical context, room color, specimen label, reagent, vendor. Patient age, clinical context. Scoring suggesting 0 to 30 need review. From 0 to 34 need review. From 35 to 42 competent. From 40C to 50 strong mastery. Thank you.